During this pandemic, experts are calling on the government to release some prisoners. They're worried about potential COVID-19 outbreaks amid Omicron in provincial and federal facilities. The tight living quarters make prison populations more vulnerable to outbreaks. Correctional Service Canada says there have been outbreaks at 16 federal prisons since the start of December 2021, when Omicron first began to spread in the country. By comparison, it had reported outbreaks at 12 institutions over the previous 6 months. Advocates want early parole for some federal inmates and for provincial governments to cut down the time people are held on remand while awaiting trial. They also want alternatives considered for those sentenced, such as house arrest. Well, joining me now, one of those experts calling for inmate releases. Justin Piché is a criminologist and associate professor of criminology at the University of Ottawa. He's also been tracking the spread of COVID-19 across federal, provincial, and territorial prisons and jails since the beginning of the pandemic. So you're the man to talk to. Justin, thanks for joining us tonight.
Thank you.
Why is the release of inmates the right answer to curb outbreaks, in your opinion, and how would that work?
So prior to the arrival of the Omicron variant, the rate of COVID-19 transmission in provincial territorial jails and prisons and federal penitentiaries was more than 5 times greater than that of the general population, according to research by Valerie Willette from CBC News. And since the start of the pandemic, I, along with researchers from the Prison Pandemic Partnership, have identified more than 11,250 cases linked to these sites of human caging, including 8,400 cases amongst prisoners and 2,800 cases amongst prison staff. And with Omicron variant growing in prominence over the past month, over 650 prisoners and 550 staff members have contracted COVID-19 in December alone, which is roughly 11% of the cases since the start of the pandemic. And that's really alarming. And according to Imprisoned People that I'm in touch with as editor of the Journal of Prisoners on Prisons and Prisoners That Call, the Jail Accountability and Information Line, run by my friend Suhail Bensliman, many so-called correctional facilities don't have adequate PPE, as well as cleaning and hygiene products right now at the height of this global pandemic. And so when COVID-19 outbreaks happen behind bars, the disease doesn't stay contained there. For instance, we know staff are entering those facilities, those congregate settings day in and day out. They're returning home to their families and our communities, frequenting the same places that we all do. And community transmission connected to these sites occurs. So outbreaks behind bars have impacts that reverberate well beyond them from a public health perspective.
Justin, we have, as you know, seen inmate releases at both the federal and provincial and territorial levels since the beginning of the pandemic. Who is being released and what should that look like? Who is the ideal prisoner who you think could be looking at an alternative right now to try to cut down on these outbreaks?
In terms of who's being released, human beings, we have Indigenous people living with the trauma of genocidal efforts to separate them from their lands, destroy their languages and cultures and spiritualities through residential schools, the reserve system, Safety Scoop, and mass adoption. They're mass incarcerated in this country. Black people are mass incarcerated in this country, and that's linked to the legacies of slavery and anti-Black racism here in Canada. A quarter of prisoners are cycling from homeless shelters. They have no fixed address, so difficult time getting bail. Many are living in poverty, can't get a surety to get bail. Many are criminalized for living with mental health issues, using prohibited drugs. And we're talking about people being pushed to the margins of our society.